and we're seeing everyone. We're just waiting and we're going to get started as people are joining. So I'm going to do a little introduction to everyone. Hi, good afternoon, and welcome to the Mail and Guardian webinar, kindly sponsored by Dr. Reddy's. Today, really unpacking the psychological impact of COVID-19 and lockdown. My name is Cassey Chambers, and I'm the Operations Director at the South African Depression and Anxiety Group. And welcome to everyone who's joined today. We have an amazing nearly 1,200 people that are joining us from around the world to discuss this very important topic. So thank you. The global pandemic, COVID-19, has affected all South Africans and has a profound impact on our mental health, whether we've had a mental health issue before or not. For the first time, South Africans have had to deal with social distancing, lockdown, an extended lockdown, new regulations and restrictions every single week. Many people have felt anxious, stressed, overwhelmed, and overall just really battling to cope and adjust. With me today to unpack the impact of COVID-19 on our mental health is Dr. Frans Korb, who is one of the few experts in South Africa who is both a psychiatrist and a psychologist. He works both in the state sector and currently also runs a private practice in Joburg. Dr. Korb is also the chairperson of the SADAG board and has been part of SADAG for the last 26 years since we started. Today's format will be a Q&A session. We're going to just start unpacking the topic. But we encourage you to ask questions in the chat section on the webinar platform, and I'll pose these questions to Dr. Frans to chat and to answer. While we start this important conversation about the impact of mental health throughout and beyond lockdown and COVID-19, which we know is going to be with us for the next few months at least, we encourage you and remind you that the conversation should not just start and end today. This is just starting the conversation, and we encourage you to engage, continue talking and discussing this topic at home, in your workplaces, and with your friends. We will give out our contact details at the end of the session, and you'll be able to engage with us. So I think we're Dr. Frans Korb, welcome. Good afternoon. We're going to get started and really just to pose the question to you going up. SADAG has recently completed an online survey looking at COVID-19 and mental health. And one of the alarming stats that came out of it is that 65% of people felt very stressed during lockdown. Could you maybe start to unpack what the mental health impact of COVID-19 would be?
Yeah, Cassey, I mean, that is the whole topic of this afternoon, is talking about the mental impact or the psychological impact of this whole pandemic. Just to start off with, maybe as introduction, thank you for inviting me. And I think this is so important that we do have these kind of webinars, open forums where we can discuss things. Obviously, it's not the first time that the world has been faced with a pandemic, but I think the magnitude of this one has been unprecedented since the last one, which was almost 100 years ago. And thus far, you know, if one looks at everything, there has been so much stress, there's been so much emphasis on all the physical things. You know, the medical aspects of the disease, how it spread, what to do, what not to do, how many people are dying, that in a way, initially, I think we forgot about the psychological impact. But if you now look at the last few weeks, at least there's been lots being written about the psychological impact, which I think is the thing that's going to stay. As you said, the virus will be with us for the next few months, at least in South Africa, until the end of our winter. But I think the psychological impact might be the one that we'll have to deal with much longer, even after they found a treatment and a vaccination for COVID-19. The psychological impact is going to stay with us for a long, long, long time, and we'll have to deal with that. If we look at the kind of impact, I mean, there is just so much that has been happening at the moment, or psychological things that can happen. That's why I'm also looking forward to the questions. Hopefully people will type in questions, and that we can make it more a discussion rather than just me doing a lecture. I've got lots of papers here around me that if people really want to just have a paper talk, then it's easy to do that. But I think the first thing we need to look at is really And I would like the people's views there as well. We've done the StatX survey, and maybe throughout this next hour we can highlight a little bit of the things that comes up from there. I think the two main things as I see it currently from a psychiatric point of view is, first of all, are the psychological consequences of what is happening to us at the moment. So that is the kind of new things, if I can call it that, that's happening during this time on the one hand. And I think on the other hand, we mustn't forget the people with existing psychiatric illness or psychological problems. So, those are the two kind of fields that I think we need to look at. Obviously, the main thing that this epidemic is causing is stress. And I think that is the kind of word where we should start from, is from stress. And what is causing the stress? And there are several things. If one looks at what is in our survey as well, and maybe please, Cassey, chip in and tell us a little bit about the survey and the findings there as well, because although it's a kind of relatively small survey, although over 1,000 people did respond, it still gives us an idea. But if you look at the kinds of, Cassey?
No, and I think it's exactly that as well, what you're saying, Frans, is, getting some insight and information, especially in South Africa. We know that around the world there are news and information and stats and research that's already happened. And to know in South Africa for the first time that we've got stats around how it is impacting our mental health is really important. And I think you touched on an important topic. Those that already had depression or anxiety or a mental health issue before COVID or lockdown, maybe you can explain or unpack what is the kind of impact that lockdown might have on their symptoms already. How could it make it worse?
I think we all know that any psychiatric illness, whether it's depression, whether it's anxiety, whether it's bipolar, whether it's the more severe ones like schizophrenia, what triggers a breakdown, there are many things that causes a breakdown, but one of the main causes of a breakdown, of course, is stress. And if a person is under severe stress, constant stress, that can easily get your anxiety to go out of control. It can easily trigger another depressive episode. So stress is the thing we need to kind of control through this whole period that is going to be with us for quite a lot of months. So it's really coping with the stress. And if we look, maybe I can just in the next few minutes, Cassey, just mention a few things that, if you look at that, and I've tried to summarize the psychiatric and psychological literature that's now been flooded with all the psychological things at this point, the kind of things that cause stress during a lockdown like this. The first thing, of course, is the duration of the lockdown, the quarantine, that kind of thing, because the longer it goes on, the more the insecurity becomes. People feel more insecure. I mean, the longer it lasts, will I have a job? Will I have finances? Will I have money to buy food eventually? What is going to happen? And they've shown somehow interesting that if a lockdown was shorter than 10 days, and I don't think there's anywhere in the world where it was shorter than 10 days, people can cope with it. But any lockdown longer than 10 days is it where it's really causing that kind of severe insecurity. So that's the first one. It's really the duration of the quarantine. The second most important thing that has come up in this time is the fear of infection. And there is lots of aspects around the fear of infection. Will I get it? Won't I get it? If I get it, what's going to happen with me? Will I be one of the lucky ones that will just have a few symptoms and it'll go over? And I suppose if one looks at it, more the people in the kind of danger groups, the older people, the people with cardiovascular disease, the people with overweight, the people with diabetes, those are the people, that I think the fear aspect will be much higher. So that's the second one, the fear of infection. And even if I get the infection, I mean, will I recover totally? Will I be able to go back to work? And I think together with that, perhaps, with something that lots of people didn't touch on is guilt. And that brings me back to the video, I think, Cassey, it was about 2-3 weeks ago, where a nursing sister in the US committed suicide because she blamed herself for felt she was the one that brought the coronavirus infection into the hospital and infected a few other people, and a few people died. And she felt so guilty about that. I think, especially perhaps in our South African situation, where we do have rural areas where people live on top of each other, where we have informal settlements where people are really living in close proximity. If I get the virus, I'm going to infect everybody around. And where do you go to if you get it to try and keep the social or physical distance from those people? So that's the second thing, is that fear of infection. The third thing that is so much emphasized as well is the whole thing about the feelings of frustration and boredom. And that is something we need to cope with. Those feelings of frustration and boredom. That's why there are just such a lot of things being published on how to keep busy, just play games, walk around your house, do things that you've done in the past, get out your hobbies, that kind of thing, and keep active. You know, you can watch so much TV, but to sit in front of the TV for 5 weeks, I think is also not a good thing. So that whole thing of frustration and boredom is keeping busy. That's the third one. The fourth thing, perhaps in South Africa as well, is really the kind of inadequate supplies of food and medication and that kind of things. But I think the government has said over and over and over again that there will be enough food. Supermarkets will stay open. There's no need to rush and buy and hoard and carry on. Pharmacies will stay open. You will be able to get your food. You will be able to get those things. And then I've also read yesterday to this last night, I think, people have got a fear that they're not going to get the food parcels that the government has promised that they will provide. So that is the fourth thing, that kind of inadequate supplies. And I think the fifth point, which I think in a way is the most important thing, is information. The whole, every WhatsApp, every internet site, every I think five out of one email will have something about the virus. And I think there is just so much information out there that people must say, I'm going to limit myself to this information, and I'm going to stick to the world-renowned or the sites where I can get the proper information. And I think information, getting the kind of right information, the correct information, is the most important one. So those are the 5 main things, as I see it, that centers around the whole COVID virus at the moment from a psychological point of view. We can perhaps later talk about perhaps what is going to happen afterwards, after the lockdown, after the lockdown period. Yeah, Cassey?
And I think what's so helpful is that during this time, so many people can relate to all the things that you're talking about, the fear, their anxiety, the worry about ourselves, our families, other people, how you're getting food. I think that there's so many different triggers and stresses that we're experiencing during this time as adults, as the elderly, and children and teenagers. And I see lots of questions about how to help teenagers and children, which I really do think is important to come to and to give those tips and tools. I think also just to touch on that information overload. And I think especially now we're constantly on news, social media, even all the activities that we've been encouraged to do are going online, go do this museum tour, take this online course, do this. And I think in everything, it's just too much. And I often also feel myself, it's an information overload. And we're constantly bombarded with everything to do around COVID-19. And I think having to find that balance of enough information and too much information. One of the tips that SADAG is even encouraging is that during this time is to filter how much time and how much energy you're spending on social media or news updates, having it constantly in the background, listening to it all the time. Not only is it not good for your mental health, but if you've got other people in the household with you, you know, all of that information is also absorbed, and especially for children and teenagers, it has a huge impact on them. So we're currently suggesting to people to filter how much information they're getting, perhaps choose specific times in the day to access your news updates. Again, use reliable sources. I know through this time of social distancing, we're encouraging people to connect and find virtual ways of staying in touch. Have a WhatsApp group, and I'm sure a lot of people can feel there are tons of WhatsApp groups, Zoom sessions and video sessions and all these different ways of staying connected. And that in itself can also be just too much information and too much pressure and constant updates, constant pinging. And that in itself can sometimes raise anxiety. So it's kind of, we went into lockdown preparing for 3 weeks, and then it got extended. And we now know that COVID-19 is going to be with us for months. So it's important to kind of at this point, as we find ourselves being slightly even complacent or frustrated or over this whole thing, as many people can go through that roller coaster of emotions, is to kind of just reset on those self-help tips and those things that you've mentioned now, the fear and the anxiety. And I think it's to kind of re-strategize to look after our mental health. And I think that's also really, really important. And I think perhaps you can also help us, Dr. Korb, is the concern as well as how do we help a loved one? What symptoms or warning signs do we look out for if we can see that they're not coping or they're not managing through this time? And what should we do about it? How do we help them?
Yeah, just to take one step back before we get to that question or that aspect. The thing about social media is so important. The last 2 nights I've been listening to 2 webinars, one from the US and one from Canada. And last night I was listening to the one from the NIMH in the US, where they spoke about suicide. And the whole link between social media and suicide was discussed. And where they found that people, there's a direct relationship between the amount of time people spend on social media and suicide. Because people have been shown that purely do social media are more prone to loneliness, because they kind of lose that kind of contact, that kind of social interaction with other people, and they're just on their social media all the time. So what they do recommend is, especially and I don't only think at this time, but all the time, is that one should really limit the amount of time you spend on social media, and rather look at a more balanced lifestyle at this stage. Not only sit in social media all the time, say, I'm only going to do it for an hour a day and that's it. The rest of the time, I'm going to go for a walk around the property. I'm going to work on a hobby. I'm going to read a book. I'm going to watch a television program. Get involved with your hobbies and your interests, whatever you do. And the other big thing is contact. I know we can't move around, we can't visit, but phone people. Speak to people, video conference people, Skype people, Zoom people. Keep contact with people around you, family, friends. I've even had contact with people I haven't heard from years, from my old university friends. Things have been phoning me. And I think, good heavens, these days it's so easy to get people's contact numbers and trace people with the internet. So really, the whole thing about social media, I think we need to address in future as well, in terms of social isolation, kind of almost losing that kind of ability to be sociable, leading to loneliness, leading to suicidal ideation and suicide attempts. So I think the whole thing about social media is very important that you just brought up as well. Obviously, I think what CC, one of the questions that's been asked is depression and anxiety the same during the COVID epidemic than not? Of course, it's exactly the same. There's no difference between a person becoming depressed now and a person that became depressed before the COVID epidemic started. So it's the normal things, if a person becomes depressed, to see that they are becoming more socially withdrawn, more quiet, more kind of inner focused, picking up the feelings that people are not feeling well, that they are depressed. And if people do become depressed, make contact with the relevant psychologists, psychiatrists, GPs. At least the emergency services are still there. I mean, normal run-of-the-mill practices we're not allowed to have during this time. But if there are emergencies, then there will always be a plan that one can make. I think the other thing that's coming to mind now as well, Cassey, that we must please remember that during this time that people must take their treatments. Please, people, take your treatment. If you're on antidepressants and whatever medication you're on, please make sure that you are taking your medication regularly. So I think the main thing, which is the main emphasis from a psychological point of view throughout this whole time, is to stay balanced. Don't isolate yourself. Don't stay in bed for the whole day. Get up in the mornings. There's that one nice one that I saw from a psychologist in the US where she looked so
I think I've just lost some signal. Don't know if... I think I might have just lost some signal, Frans. I've lost you for a second.
and underneath they've got a tracksuit and bare feet. So I think it's very important. Cassey, you back?
I'm back, yes, sorry. I'm back, yeah. It was not, yeah.
It's that old thing where I saw this the last week again, the presenter that was beautifully above the camera like you are now. And then when they got up, there was just a tracksuit, a pants underneath, and flip-flops and bare feet. And I think, you know what, that also says, get up every morning, get dressed properly. Even if you stay in your house and you're not going to leave the house, get dressed, do your makeup, all those kind of things, get exercise, all of that kind of thing. So it's really important to kind of make sure that we carry on living and that life hasn't come to an end during this lockdown.
And I think
and perhaps also, you know, the other thing that they say is, Cassey, that you must do things. You know, do things you always wanted to do. Clean out the garage. Clean out cupboards. Sort out clothes that you haven't done. Sort out your, I don't think there are photo albums anymore, but if you had a photo album you wanted to sort out for a long time, or a box of books that you wanted to sort out what you want to keep and want to throw away. There are just so many things that this quiet time gives us the opportunity to do and catch up.
And I think that's also important, you know, and we often find from the calls that we get at SADC, during this time we've received many calls. Our calls have increased from people who feel depressed or anxious or stressed or lonely. And I think also now as we've hit that peak of 4 weeks into lockdown, having to be reminded what to do to keep busy. And yes, it is okay to be frustrated. I think one of the really interesting things with COVID and lockdown specifically, and especially as South Africans, that we've never had to do lockdown before, we don't know what to expect or anticipate, is really a roller coaster of emotions, almost on the same levels or stages of grief, feeling angry, bargaining, accepting, finding out what you can control, and sometimes you're feeling numb. And I think it's really important for people to also relate and to share if they're having a bad day or if they're having a bad moment. And it's okay to feel like that. It's also important. It's part of the process. But it's also so key in those moments is you have a go-to list, a go-to kind of resource that you can have that's public in the house, on the fridge, somewhere in the house that you can go to. Because often the whole nature of the illness, right, of depression or anxiety is that it's low mood, low motivation, low need to want to do anything. And especially during lockdown, it's hard to self-motivate every single day when we're not used to a normal routine of getting up and being motivated and focused and having a place to go and people to see. And I think when we're feeling down and low is to have a list that you can go to with some of the ideas that you've mentioned, Frans, is Don't assume that you're going to be able to come up with your positive self-talk that's going to get you out of that bad mood or that funk that you're feeling. Is have a list that you can go to with all these things you want to try to do. And it's also okay if some days you're just like, you know what, I'm taking a break, I'm taking a duvet day. And some other days when you're really needing to get motivated and you feel really bad is to go to your list. What things make you feel better? How do you fill up your cup? Once your cup is full, you can give to other people. And self-care is so much more important during this time to really look after ourselves. And it's having that go-to list, sharing, reaching out to people when you don't know what to do. So kind of providing or putting together your toolkit. And I think it brings me to something as well is yes, self-help tips and this stuff is all really important. And I think what are some of the concerns if we don't look after our mental health during this time? What are some of the consequences? What could the long-term impact be on someone who perhaps has a mental health issue or even someone who doesn't have a mental health issue? What are some of the concerns?
Yeah, I mean, obviously the main thing is if one is predisposed to perhaps depression or anxiety or panic or one of those kind of things, that this long-term stress, this long-term stress period, toxic kind of a stressful period, will eventually trigger a proper depressive episode that you then will have to need to get professional help and go for help. So that is one of the things, if you are predisposed, that this period can bring out a proper depressive episode during this time, or start panicking or develop panic attacks or increased anxiety, general anxiety, or one of those kind of things, Cassey. But
so it's almost like a prevention method, preventing it from getting worse. It's really doing things now to look after our mental health so that later on there isn't a crisis or a relapse or something like that.
Yeah. The main thing during this period is that we need to look after ourselves. We need to care for ourselves. We need to try and stay positive. And it's not always so easy, but I mean, there are lots of ways, like we're saying, doing things you enjoy, contacting people, living a balanced kind of a lifestyle, looking after your diet, getting some exercise, eating properly. I mean, there's been so many jokes going around how people will gain weight and how many weight people will gain through this period. I think everybody is now taking up cooking during this 5-week period because of the amount of people that are WhatsApping me pictures of the food that they've been making. So I think it's really staying active, staying balanced, and doing things that really you enjoy doing, staying positive, and try and get away from those feelings, like you say, of despair, of hopelessness, of helplessness, all those kind of things, isolation, anger, all those feelings. One should really try, because those feelings are so easy to kind of take over your psyche. And the more you allow those feelings to happen, the more difficult it's going to get to be able to get out of it again. So I think one of the things that you almost said is that people must really acknowledge the feelings they've got, acknowledge the emotions they've got, and then try and move on from there. Okay to feel sad for a day and say, I've had enough of this. But then it's going to be for another week or two, and then we'll see what happens, what the president's going to announce on Thursday.
Absolutely, and it's to kind of anticipate for that. And I think, we can chat ourselves on mental health, and I'd really love to get to some of the questions. I just want to remind everyone as well that there is a poll. If you are joined in from wherever you are around the world, please fill in the poll. It's on the chat. There's an icon there just to fill in. Please do fill it in, and we'll give some of those results towards the end of the chat. I wanted to go through some of the questions because I think it again touches on the themes that we want to unpack. Yes, Mandy, we're going to get to the questions. Thank you for reminding us. Just the first question. Thank you. Yes, just a reminder, the recording will be available after the webinar. I think that's very helpful. Just getting to some questions. Samantha, children's screen time has increased dramatically during this time. And Samantha, I can relate. I have 2 small children, and yes, it is a concern that we are increasing some screen time, especially when parents are trying to work from home. I had a really interesting meme, because there's the power of memes and social media that is being shared, is that we must be very careful to say our normal routine. Lockdown and COVID-19 is not normal. What we're trying to do is not normal. We're trying to create a new normal. So when we're talking about we're working from home, it's more that we're working from home in a crisis. We're teaching our children or homeschooling during a crisis. And I think it just helps us to take the pressure off a little bit with that as well. Is there any research, Dr. Frans Korb, on the psychological impact of increased screen time, and especially because you attended that webinar recently? Is there a link between increased screen time and impact on psychological effects, especially for children or adults?
Yeah, there's lots being done on screen time, and I think the main thing in a normal situation will be, the first thing is to limit screen time. So that's the one thing, is to limit screen time. And the second thing that is important will be the content of what you allow the children to watch. So those are the 2 main things, is the amount of time and as well as the content. Now, coming into the current situation, which is very difficult, because normal times you can say, you've got an hour after supper tonight to watch TV, and then you must do something else, or go and play outside, or go to the neighbors and play with the children, or that kind of thing, which we can't do now. So this is really a very difficult situation. But I do think we should still try and limit screen time. I mean, there are so many other things one can do now, is the children can go and play outside, force them to go and play outside, and let them still watch their hour or 2 hours. I'm not just putting an arbitrary figure to it, their favorite programs. But also try and bring in other healthy things like playing games with each other. I mean, it's now the ideal time for families to reconnect, to start playing games. You know, I don't know if Monopoly or Scrabble or these things still exist. But really try and balance it. I think to allow your child just to sit in front of the TV for 5 weeks and watch whatever they want to, that is not balanced, and that is not normal. But I do think, on the other hand, that, Cassey, one should be honest with children and say this is an abnormal time, you know, and explain to children. We so often think that children will not understand the whole concept of epidemics and viruses and infections and disease and that kind of things. And surely we can explain to them in a very simple way what this is. This is an abnormal situation, and why the world, in what is happening with the world at this stage. But I don't think that just letting your child sitting in front of TV, I know it's perhaps the easiest way, Cassey, to tell your children, I'm working, go and watch TV or play computer games. But they should still be the emphasis on balance. That they should really be play outside, go for a walk, go and do something else in your room, go and whatever.
I think it's important. It's finding balance. And I think also, just from a mom to fellow moms, is also cutting ourselves some slack. I know it is very difficult as a working mom, is that we're now having to juggle a household, things to do, children, work, which is busy, and we're expected to perform and spend those working hours. And I think one of the things as well is that we're from working at home in a crisis, is having to really adjust, being flexible, working hours, where you're working, how it's going to work, having an honest conversation with your employee or your colleagues to say, these are the best times that I can do, and having to adjust every day. Some days are good. Some days you have it and you're on top of it and you can get it done. Other days are more difficult, and that's okay. We try better the next day. I think it's hard for everyone to adjust and cope. And I think as a parent, when we take on all these extra, everyone else's anxieties, and especially during this time, it can be hard. So I hope that answers Samantha's questions. Another question here. Yes.
Just one other thing is just to comment as well. I mean, one should now, it's also the ideal time to get the children involved. If you're going to say, today we are going to unpack your toy cupboard, and see what things you still play with, what you don't play with, what you want to throw away, what is now you've grown out of it. And let's, after the lockdown, we're going to give it to an orphanage or something and get the child involved to sort out their cupboard. And you do it with the child. Or even cooking. You know, get the child to make muffins, bake muffins with you. You know, let them mix the bowl, let them measure things, whatever. And let them dish it into the little cups. There are just so many things you can involve the children with than just letting them get it out of your way and go and watch TV. Sorry, carry on to the next question.
And then a question from Jacques. People with pre-existing mental health conditions are hit harder. How do we cope? And some of us have the fear that the medication won't work or won't be enough to manage during these times. And people around us don't always understand mental health and how this impacts. How would you answer that?
I think, you know, Cassey, with people with existing depression, anxiety, with mental health problems, it is even more important for those people to try and live, or to try and through this time, to live a balanced lifestyle. You know, to be in total isolation and total lockdown is really going to be the worst for people that already suffers from depression. So for people during this time that does have a pre-existing mental health condition, it's very important there to stay healthy, to eat healthy, to get some exercise, to go for walks around your house. You know, even if you go to the shops every day and buy a little bit, but at least it gives you an opportunity to get out of the house and go and buy something and just get some fresh air outside. So I think for people with a pre-existing mental condition, the balanced lifestyle that they keep on saying so much about during this lockdown is the most important. The second thing, obviously, is, like we said before just now, stay on your medication. Please don't change medication, don't stop medication, don't reduce medication. Just think, now I'm in lockdown, so I don't need as much medication as I do need before the lockdown. So stay on your medication. And obviously, if there are problems, contact your psychologist, contact your psychiatrist, contact your doctor, contact SADC. SADC has got a helpline, and you can perhaps do some stats as well just now, that the numbers of calls has increased since the lockdown started. So at least there are groups and things, and there are besides SADC, I mean, there are lots of other groups that have now started helplines as well. You know, the Medical Association has started a helpline where people can phone in for, that's now more medical COVID answers. So there are lots of things that people can do with the pre-existing conditions just to try and keep the balance and stay healthy. But I think the most important one is stay on your medication, avoid isolation and loneliness. Those are the two, I think, the most important thing. And then lastly, there's a helpline if you need help to talk to.
Yeah. And I think also during lockdown, when we're forced to do social distancing, it's really now important that we actually look at ways of being, you know, connecting and really looking after our mental health that we haven't had the luxuries before. And one of the concerns and a lot of the queries that we get even to SADC is with regards to accessing medication during this time, or even mental health services. How do I see a psychologist? Can I still go to someone and see them face to face? Or what options and alternatives? And I think it's also important that if someone is on medication, even for a chronic disease, hypertension, diabetes, epilepsy, it's to really ensure that you're staying on treatment during this time. If your medication is soon to run out, make sure that you plan ahead and phone your doctor beforehand if you're needing a script. Phone the pharmacy ahead of time instead of having to go out and stand in the queues and you know, potentially with other people that may be sick or at risk. So make sure that they have your medication in stock. And there are organizations, I know a lot in the government hospitals and clinics, often one of the main issues that people call us with is that medication stockouts. It's not available. I go there, I get turned away. So what you can do, and again, SADC can assist, and even if you go online or speak to someone, check your appointment card. You can phone the clinic beforehand and check if they have your medication in stock. And if not, we can phone the next clinic or ask them if they know if there's a hospital or clinic that does have in stock. the most important thing is that you don't go without taking your chronic medication, because that would just, change the chemicals and actually could even lead to things like risk or relapse. Being able to access psychological or counseling services, and this is open to everyone and anyone, whether you have resources or not. And I'm going to touch on one of the topics, some of the things that we've spoken about, Frans, is like screen time and playing outside. And we know that those are also in a privileged background. And there's a lot of people who don't have those resources or access or money to see a psychologist. I think the most important thing to provide counseling and therapy during this time, especially to help us cope, is if you are seeing a psychologist, continue with those sessions. Phone ahead, find out if there are, different things or safety measures that they've put in place, social distancing or hygiene, sanitary type of issues that they've put in place to make sure a safe face-to-face session. You can also do teletherapy or online sessions, which a lot of the psychologists are offering, and counselors. You can also get free telephonic counseling from SADAG. And there's lots of organizations that have now had to change how they normally do things. So the most important thing is that there are still services available and counseling. And it's sometimes just about where to find those resources and to access them. And I think through both the CDC and the coronavirus hotline and their website, and through SADAG, as we're sharing a lot of those details. I think also, Frans, to bring us to the next question is, we know for a lot of South Africans, the situation of having a garden, being able to go outside, for the poorer community, there's a lot of extra stresses, a job loss, financial, food. All of this can have a huge impact on our mental health. Do you have any tips or advice as to what we should be doing, or how the impact of COVID-19 could be on someone's mental health for those vulnerable groups?
Yeah, just before I get there again, just one thing, Cassey, I just quickly want to mention is the kind of suggestion now is we must stop talking about social distancing, but rather physical distancing, because we need to keep a physical distance from somebody and not a social distance. We shouldn't isolate ourselves socially. So it's not social distancing, it's physical distancing. So we should really just keep our distance, physical distance from people to avoid catching the virus. So just an interesting one there. Yeah, but to get back to your question, that's now a difficult one. When they looked at to carry on to the next kind of era is what happens after lockdown, and the two main things that people mention from a psychological point of view. The two main things is financial. So how am I going to cope financially if I've been retrenched? Will I still have a job afterwards? That kind of thing. So finances is a big thing. And the second big thing, psychological thing, is stigma, which we have really spoken about is what about the stigma? Will people that have had the virus, the COVID virus, be stigmatized in the same way as people with mental illness have been stigmatized? Or the whole question of stigma after lockdown, you've infected so many people, or you infected my grandmother, that's why my grandmother died. That whole kind of thing about stigma that we haven't thought about thoroughly through yet. But those are the two main things, the financial things as well as the stigma after lockdown. Now, the financial one, I think, is a very difficult one. I mean, how do we cope with finances? At least, last night our president really tried and through a helpline to everybody in the country, whether you a person with disability on a social grant with a small business. There's so many packages out there. There's so many relief. I don't understand all of them actually, but at least there is such a lot of helplines from a financial point of view. But still, Cassey, that doesn't do away with the kind of inner fear of how long is it going to last? I mean, the extra 500 Rand on the social packages, as I understand it, for the next 3 months is only going to be for a short term. After that, the finances will be going back to the normal where it was before. So, I think, the people keep on saying, and perhaps that is true, that the world is going to be very different after COVID-19 is over in the next 6 months or a year. the world is going to be a different place. And I think we'll have to all start thinking differently and living differently to what we've done in the past. So, with financial stress is a difficult one. I can't really give advice there, but I think people must just try and stay positive. They always say that one of the entrepreneurs are born out of through difficult times. But I think, we need to just try and stay positive and not give up. And I think that's why we're all here, to try and support as well the people that are going through a very, very difficult financial period.
And I think everyone can relate to having the financial impact, because I think it's very real, whether some of the financial issues, whether you live in a township or into a shack with 10 other people, these are really real issues. Job security. Am I still going to have a job? A lot of companies have already announced restructuring, retrenchments. These are real fears, and this is really difficult to often cope with. And I think it's to be proactive and to start planning. There's a lot of different articles, again, online, and different resources available to help you on what to do financially. What options do you have available? What relief can you apply for? And this could be, simply speaking to your financial advisor, your broker, your bank. Use those resources, tap into them. I think one of the other concerns, and we get many requests on a daily basis, is with regards to food security and food parcels, and how am I going to feed my family? And I think for a lot of South Africans, the majority, this is a real concern, and this is a real issue of how am I going to get food on the table? If I lose my job, I'm the only breadwinner, I'm looking after 15 people. And I think this is where we're even encouraging our other fellow South Africans who are in a different position, that we can say, I don't have much, but I can donate here, or at least connect with your local church or food distribution. And there's amazing resources online, again, that you can connect to and find out. It's not just the Department of Social Development or SASSA doing food distribution. There are amazing organizations that are doing this every single day. And sometimes just even creating awareness, even sharing how people can donate or make sandwiches, doing something positive and helping out, actually improves our own mental health. So we urge people to also connect to that. So a lot of the questions are coming through regarding, and you've touched on it already, Frans, is the stigma. The stigma of testing, and especially as we see the number of people testing for corona increasing and the number of people testing positive, there's this new stigma that's going to come from being diagnosed positive with COVID-19 and having to deal with that anxiety. What are people going to think about me? What are people going to say? People are going to think I'm dirty and unclean and feel guilty and shameful. How do we kind of anticipate, how do we deal with that now going into a new wave of testing and diagnosis and more people? How do we deal with that test anxiety or testing positive?
Yeah. I think the main thing there, Cassey, to deal with it is to really fall back onto the scientific facts. That the COVID virus or the coronavirus or COVID-19 virus is a type of a flu virus. And I think it's the same as mental illness, that people must know the facts about what it is all about. And I think it's out of not misinformation, it's partly misinformation or people with not enough information are the ones that really do the stigmatizing, because they don't realize, every year all of us get flus. And if we get a flu, we don't get blamed for that you've infected other people or whatever. So, people need to get on top of what are the facts about this virus. This is unfortunately one of the most potent flu viruses that we've had in the last 100 years. And it really, at this stage, looks like it's killing lots of people. But only after in the next year, 18 months, will we really see the true facts, and will the scientists get totally behind this whole thing. But I think the main thing is really is looking at the true, what are the scientific facts about this virus. And that is what people want to get to understand. Because I think if they understand the true facts, then the stigma should be less as well.
Yeah. And I think, again, with any test anxiety, similar to what, a lot of people feel when they get tested for HIV, it's important to go in and have pre-counseling or pre-assessment. And then afterwards, someone who is tested positive, educate yourself on the signs and symptoms of corona and what treatment looks like and how it's spread. I think that's important, and to share that with your family and friends so that they also are empowered. And it's okay to feel down and more stressed and anxious during that time. Reaching out and connecting to other people and staying connected, not doing the social distancing, but physical distancing is important. But they too need support. So if you're a family member and you know someone has been tested positive with corona, reach out to them. Even if you send them a picture to lift their mood, share your favorite song, just to check in with them, because they too could be feeling really down and anxious living with the virus themselves.
You see, please remember, you recover from this. I mean, people recover from the infection. You know, it takes anything up to 2 weeks, but you recover from it, and then it's over. Then your body's built up immunity. Hopefully, it looks like any other infection. Your body's built up an immunity against it, and after that, you symptom free. You healed. You are over the flu. Are you over the virus? But people kind of view it like it's something that's going to continue forever. And for the rest of your life, you're going to infect people. It's not that kind. It's not that kind of virus. It's something that will go over. People, and you'll see on the news every day how many people have recovered. People that have tested positive, people that have recovered, and people that have died, unfortunately. So look at the stats every day. So that is very important. I quickly want to ask.
And I think also, you carry on, Frans.
Our time is going to run out. 2 things I was thinking about we really need to mention is, first of all, when you do look up the facts, please look up reliable sources. Use and I think the ones that is recommended is the WHO, the World Health Organization. Go onto their website, and there you will get the proper kind of information on the virus, the World Health, WHO, World Health Organization. The second one is the CDC. The Centers for Disease Control in the US. They've got good sites where you can go onto and get proper, balanced information about the virus. And of course, in South Africa, go onto the government website. The government website has got a special website you can go onto where you can get up-to-date information of what's happening in South Africa. So I think if you limit yourself to those 3, already you'll have a good, balanced kind of a view of what is happening. The WHO, the CDC, and then our local government South African website, I think, is important. The last thing before we log off, which we haven't touched on, Cassey, is substance abuse. Because I think substance abuse is such a big thing, and I don't want to say if I'm for or against no alcohol and no cigarettes during these 5 or 6 weeks, but I think that is part of a balanced lifestyle. Is do not now during this lockdown period go and drown your sorrows and drown your emotions in alcohol and all kinds of things. So please, during this time, stay away from alcohol. And the government has got their reasons why they've done it and why they've banned alcohol and cigarettes during this period, because it promotes social contact. So I think, from my point of view, that's the main thing, is to avoid social contact, because where there's alcohol, people get together. So you know, that kind of thing. But from my point of view, part of a balanced lifestyle is really to absolutely minimize alcohol. So I think substance abuse is also a big thing, which we haven't got much time to speak about, but I think that's an important one, Cassey.
Yeah. And I think what, again, you know, from the beginning of this webinar, and there's so many questions, and I feel anxious for the fact that we can't answer all of them, but we're going to make a way to answer all of these questions and share it with everyone. And I do think that this conversation and this kind of discussion, and on all the different themes and topics that people have brought up, should be an ongoing conversation, and to use beyond lockdown. These are conversations that affect us before COVID and have now also made it even more difficult. So I really want to encourage, and as SADAG, we will take on whatever we can to ensure that we provide more access, more opportunity to have these conversations and to share information. I know a lot of people are asking, what podcasts can we listen to? What webinars, what resources are available? Please have a look at SADAG's website. We and our social media, both on Facebook and Twitter, we have on a daily basis, we're sharing interesting podcasts that our experts, including Dr. Frans Korb and various other experts around the country, are tapping in and sharing, especially on how to help children who are feeling anxious during this time. What do you say? What do you not say? How do you help them? Teenagers, how do you deal with financial loss? There's so many different podcasts that you can also plug into. There's a series that Cindy Paluta did on Radio 702, and there were over 21 different podcasts that covered a lot of the topics and the themes, from loss and grief to anxiety to how to be physical at home. Even if you don't have a garden and you live in a flat or you live in a shack with 10 other people, what actually can you do without being able to go outside and go for walks? There's so much practical information. So please, we're urging all of you, go and have a look, go and have a listen, go and look at the self-help tips available on SADAG's website, and we'll continue to share it. I think these topics are really important. There's a lot also regarding what happens when we go back to work. How do we as employees deal with the extra anxiety? What should employers do? And I think that should be a topic all in itself, looking at mental health in the workplace. Meryl brought up one of the questions that came forward is that there was a lot of stigma around mental health before COVID-19. And I think especially during this time, as we're talking, COVID-19 and lockdown could actually give us the opportunity to talk more about mental health and connect, because I think so many people are having those feelings of anxiety, of stress and depression. So potentially we could use this opportunity to really connect and start these important conversations to help break the stigma around mental health. I really just want to touch base before we're ending with regards to the poll. We asked, what is your current stress and anxiety level amid COVID-19? 4% said that they need help right now, and please, I urge you, reach out to a mental health professional. If you are already seeing a psychiatrist or a psychologist, or reach out to SADAG and we can put you in touch. There's a whole network of resources available that many people don't know and don't know how to access. There was also a question about, is SADAG's helplines and services available 24 hours? Yes, they are. We have 24-hour helplines, SMS, WhatsApp chat, emails, website, as much as we can to provide support. 12% of you said they need help in the near future, and I encourage you to take those steps today. Do something, go on the website, take the tips and tools that Dr. Frans Korb has mentioned, do as much as you can today to prevent it turning into a crisis. 83% are managing and coping, and that's fantastic. And I really hope that that continues and that you're taking extra steps every day to look after your mental health as well as to others. Just to remind everyone, your questions are incredibly important to us. We're definitely going to be finding ways of answering and sharing all those answers and information going forward. And hopefully this is the first of many webinar sessions, Dr. Frans Korb, to rope you in now so that we continue this conversation around mental health. It should not end today. It's going to be here. It's going to impact everyone. Everyone can relate, or you know of someone. And it's so important to start talking. So if you're looking for information, just to share the SADAG contact details, we have a website, www.sadag.org, and you can find all of our contact details, online resources and information and podcasts, all available there. So please go. Dr. Frans Korb, can I ask you for your last message of hope or last point that you'd like to share with everyone?
Yeah, I think, thanks, Cassey. I think that the main thing is, well, there's just so many things, but I think the first thing is to try and stay positive. And to realize that, you know, we're all in this kind of situation at the moment, but there will be a brighter future to come after lockdown, after COVID. This time will go over. But during this time, please try and stay as positive as possible. Involve yourself into positive things as much as you can. Remember balanced lifestyle. And remember, if you need help, there will always be somebody out there, a person, a family member. And SADAG has been my family for the last 26 years since it started. So there's always the SADAG helpline. There's so many other things as well that you can go to. And the last thing is really, like Cassey, I fully agree with you. This is the start of a conversation. It's the first one we've done. And hopefully we can continue doing this, not only through the COVID period, but then afterwards as well. So good luck to everybody out there.
Thank you very much. We'll be answering all the questions going forward. And thanks to everyone, even sharing what has worked for them, what has helped. Please, again, look under the offers section on the platform for our helpline. There's all the helpline details and website. Helpline, again, 0800 21 22 23. A very special thank you to the Mail and Guardian and to Dr. Reddy's for sponsoring this webinar. It's very helpful for us to have these partners to help us reach more people. So thank you, everyone, for taking the time today, and look forward on the next sessions.
Thank you.
Fantastic.